Welcome everybody to yet another snow day recording. This recording is to replace the lost lecture on Thursday, our latest snow and ice event. And this recording is about the heart, chapter 1, chapter 20. We have learned everything we could possibly learn, and maybe more about this liquid connective tissue, the blood. So now it's time to turn to the motor, the heart, and let's explore how this organ moves two different types of blood at the same time, at the same pace. And so let's start with the screen sharing of the first lecture slide. Let's see if we can make this full screen. Maybe bring a laser pointer here and move this. So when we talk about this part of the cardiovascular system, the heart, we are talking about a biological pump. And as we'll see, this pump is actually two pumps glued together in the middle, two pumps that have very similar design, very similar parts, and meaning the anatomical names, and also has an identical function: move blood in one direction and pressurize this blood that is eventually coming out from the heart. So in terms of the bird's eye view gross anatomy, here is a transverse view of the thoracic cavity. You can see the large pink ovals, the lungs. You see the vertebral column right here. And here is the heart. This is located, the heart is located trapped between two bony structures, the vertebrae and the sternum here. This trapped location allows us to perform CPR. In order to move blood inside the heart, we have to put pressure on this heart. You'll see that the pressure mostly will be affecting the pumping chambers, the ventricles. But when you push down here on the sternum, if you are doing CPR, you are putting pressure on those chambers and blood will be squeezed out of the heart. When you let up on that pressure, the natural elasticity of cardiac muscle will allow the expansion of those ventricles at least a little bit, and heart and blood will feel that. With the next push, you are squeezing that blood out of the ventricles. So CPR doesn't even come close to the normal capacity of the heart, but CPR is a stopgap measure, keeping blood circulation going as much as possible until more significant help arrives. So the key to the CPR is this anatomical trapping of the heart between the sternum, vertebral column. When you push down on the sternum, the heart doesn't have room to squish to the left or to the right or go down by the stomach. The diaphragm limits its movement there. So putting pressure on the heart from the outside can lead to emptying of the ventricles of the heart. So this is probably the best illustration just how automated this movement of blood from the heart. Either the cardiac muscle needs to contract or the pressure needs to be provided from outside, like in a CPR. But the heart itself has very simple mechanical components that allows, even in the case of a non-working heart, the components allow the one directional movement of the blood, preventing backflow. And as you'll see, for a pump, that's a very important property to have. So when we look at the heart, itself, a little zoomed in view, we would be seeing a thick portion of the heart wall made up by the actual cells that create the force, cardiac muscle cells by the millions located in the myocardium layer. When we look inside the heart chambers, whether it's atria or ventricles, we would see that the cardiac muscle is separated from the blood that would be moving around right here. Cardiac muscle is separated from the blood by this thin layer of endocardium. If you recall, in the case of blood vessels, it was the endothelium that was this clot-proofing layer inside blood vessels. Once you injure the endothelium, platelet plaque formation started automatically. If we would remove the endocardium, the same kind of clot formation and platelet plaque formation would start here inside the heart. So major role for the endocardium is to prevent the clot and platelet plaque formation. It covers up the collagen that we would find inside the myocardium. On the outer side of the heart, we have two fairly thin membranes. The first thin membrane, you can barely see this thin white line, is the visceral pericardium, sometimes also called epicardium. And just a little bit outside of that, leaving a little gap between the two, is the parietal pericardium. Now, the parietal pericardium aggregates, collects a lot of connective tissue, so the entire pericardium here is a little thicker. Functional importance of these two pericardium layers is that they make a fluid that is trapped in the pericardial cavity, and the pericardial fluid serves as a lubricating structure between the heart itself and the neighboring structures. As the heart is beating inside this bag, the fluid-filled pericardial cavity, the fluid dampens the kicking effect of cardiac contractions on the neighboring tissues. So neighboring tissues won't get damaged, won't get irritated. Remember, the heart has to contract about 70, 75 times a minute, 24/7. So that constant beating, that constant kicking action of the heart could irritate neighboring tissues. So that's what this pericardial cavity filled with pericardial fluid is about. In terms of gross anatomy, we'll be focusing first on the chambers of the heart. Sulci are just grooves. We will mention them very, very lightly in our classes. We will be focusing on first the important parts of the pump that allows this pump not only to work, but to move blood only in one direction through the heart. So the chambers, obviously, important part of a pump because the fluid, in our case, the blood, needs to be contained inside the heart. But there are a few other important parts to this pump as well. So before I get into detailed explanation here, let's go back to, or let's go to an animation called a hyperheart. Let's see this heart in motion. That animation displays this heart with a lot fewer set of structures, a simplified animation, yet it will be essential to show the important parts of this heart. So before we go into this more complex image, let me screen share that hyperheart animation with you. So, and let me do the laser pointer here. And let's see if I can move this somewhere else. So what you see here is an animated and simplified heart. Just like on that static image in our textbook, you see the right side filled with blue liquid and the left side filled with a red liquid. So this is the best illustration that, excuse me, the heart is actually made of two pumps. The right side pumps only deoxygenated blood, hence the blue color. What do we need for this right side pump to work? Well, we need blood vessels that bring blood into the receiving chamber, the atrium. We need to have a pumping chamber, the ventricle. We need blood vessel to take blood out of the heart. And we also need these white colored valves that open and close according to pressure differences and prevents the backflow of blood into the previous chamber. So on that static image, we'll be naming the superior and inferior vena cava as the blood vessels. This is the right atrium. Blood flows from the right atrium to the right ventricle. And when the right ventricle contracts, let me see if I can do this and just step forward. So here is a point where the right ventricle contracts. Take a look at this valve. It's wide, it was wide open when blood is moving into the right ventricle, but when you put pressure on the blood here, the pressure closes this valve. And so the valve, which is called the tricuspid valve here, prevents the backflow of blood into the right atrium. When pressure builds up here in the right ventricle, this valve, the pulmonary semilunar valve, opens up and allow the blood to be shoved into the pulmonary artery, pulmonary trunk. Let's see how that works. You see the pressure opened up this pulmonary semilunar valve, and now the blood is moving out of the heart. So the blood flow is one directional. Blood flow came through the superior and inferior vena cavas from the right atrium, right ventricle, but there's no going back to the right atrium. If that would happen, that would degrade the output of this right side of the heart. And we'll see a little bit later under the disorder called congestive heart failure, just what is the consequence of that kind of failure. But let's complete the path of blood here. So here's the right ventricle pumping blood into the pulmonary artery, which is taking blood to the lungs. So the blood is moving out of the heart. Let's take a look at what happens when this pumping actually comes to an end. So I'm going to step this forward. Right ventricle is still contracting. And then when the right ventricle starts to relax, let me take a few more steps. The pressurized blood from a pulmonary artery would love to come back to the right ventricle when it's relaxed, but here is the pulmonary semilunar valve closing. So this is the second valve on the right side that prevents the backflow of blood into this previous chamber, in this case, the right ventricle. So these two valves, opening and closing at their own time, prevent the backflow of blood, and as a consequence, provides for the one directional flow of blood, again, from the incoming blood vessels to the atrium, ventricle, and then blood vessels taking blood away from the heart. The very same logic applies to the left side. Now, the left side is pumping only oxygenated blood. The incoming blood vessels, and one of them is shown here. This is the pulmonary vein. You see the incoming blood. Here is the left atrium. And let's step this ahead. I think left atrium will be allowing blood to move into the left ventricle right here. And so the left ventricle will be filled. But when the left ventricle contracts, you'll see valves. So when the left ventricle contracts, this valve, in this case on the left side, it's called a bicuspid valve, closes, prevents the backflow of blood into the left atrium. And another semilunar valve, the aortic semilunar valve, opens and allows the blood to flow out of the heart. So yet again, we had an incoming blood flow into the atrium, blood moved into the ventricles, and then from ventricles, blood is moving out of the heart. This curved red vessel is the aorta. And let's step this animation ahead to show that this aortic semilunar valve also closes when the left ventricle relaxes to prevent the backflow of blood into the left ventricle. So let me see if I can do this without causing major upset on this model. So here is where the left ventricle is relaxing. The low pressure would invite blood flow from the aorta, but blood cannot flow back into the left ventricle because the aortic semilunar valves are shut. So this is how these valves, and not only the chambers, are important parts of the workings of the heart. So let's go back to the static way, the textbook representation, and let's take a look at all these parts. We might mention one or two additional parts on that little more complex illustration. So here's our first step in this step-wide discussion. So we are on the right side. We are starting on the right side because, as we'll see in the second lecture, hopefully yet again in a face-to-face fashion, the starting signal to make the heart muscle move is created inside the right atrium. And so this is the first chamber that receives that signal. So the right atrium is the receiving chamber. You see the superior vena cava, inferior vena cava as incoming sources. A little later in this lecture, we'll discuss a minor source of deoxygenated blood to the right atrium. That minor source is the coronary sinus. It's not seen really well. We're going to have a much better image for that. So all that deoxygenated blood comes pressurized already. And not only that it brings blood to the atrium, but from the right atrium, blood is slowly trickling into the right ventricle. The tricuspid valve is wide open at this stage. So the ventricle is being filled at this stage. When the right ventricle is filled and the signal gets to the right ventricle to contract, cardiac muscle of the right ventricle is going to jump into action, put pressure on the blood here, and that pressure will close the tricuspid valve. The tricuspid valve is stabilized by these chordae tendineae, these stringy structures here. So with that stabilization, the tricuspid valve stays closed and prevents the backflow of blood from the right ventricle into the right atrium. Now, as blood is being pressurized in the right ventricle, blood will be finding another outlet, and that outlet will be right through the pulmonary semilunar valves. This valve will be pushed open by the building blood pressure, and blood will be squeezed into the pulmonary trunk and pulmonary arteries. So this is yet again one directional movement of blood through the right side of the heart. When the left ventricle relaxes, when the right ventricle relaxes, the pulmonary valve closes and prevents the backflow of blood from the pulmonary trunk into the right ventricle. So that completes this set of cardiac muscle, the chambers, and also the valves on the right side. And from the left side, we have a very similar pattern, just like as we explained on that animation. Into the left atrium, the receiving chamber, comes the blood from the lungs, the blood vessels that bring heart to the left atrium are called the pulmonary veins. That pressurized blood is already moving some blood into the left ventricle. This valve, the bicuspid valve, as we call it on the left side, is wide open. And once the left ventricle is filled, its contraction will be closing this bicuspid valve. So here's the left ventricle slide. Contraction of this chamber, the left ventricle, will shut the bicuspid valve. The pressurized blood in the left ventricle will need an outlet, and that is going to be the aortic semilunar valves here. Once this valve is pushed open, blood will be moving into the aorta and distributed through the rest of the body. When the left ventricle relaxes, the aortic semilunar valves close and prevent the backflow of blood from the aorta into the left ventricle. So same principle as on the right side. Blood is moving in one direction through these chambers, and that one direction is assured by the opening and closing of the valves. Please notice that on the left side, the bicuspid valve is also anchored and stabilized by chordae tendineae. So when you look at the design of the left and right side of the heart, are very, very similar looking structures. Their names are slightly different. So this set of anatomical structures completed the list of all the structures we need to work a pump. And in a healthy working heart, the left and right side are pumping exactly the same volume of blood. One is going to the lungs, and the left ventricle is pumping blood into the aorta. That blood is speeding to all organs of the body. The pressure that is needed to move blood is very different on the right and the left side of the heart. The aorta needs very little force to push blood into the ventricle, so the walls of the atria, walls of the atria are very thin. They do have cardiac muscle in it, but it takes a little force to move blood just a few inches away. The right ventricle is pumping blood towards the lungs. The lungs are very close to the heart, so there isn't a tremendous distance involved. So the right ventricle can get away with a fairly thin set of cardiac muscles. It's thicker than the atria, but it's much, much thicker when we look on the left side. The left ventricle needs to pump blood towards all organs, including organs that are very far from the heart. Think about the muscles on the foot and the leg area. Blood needs to reach even that very remote area. So the left ventricle needs to pump with much higher force. And as a consequence, the left ventricle develops a much thicker sidewall, thicker layer of cardiac muscle. Let's take a look at the valves. These are new illustrations in the latest edition of the textbook. And this is really cool because we can see how pressure from the atria open the tricuspid and bicuspid valves and shove blood into the ventricles that you see at the bottom of these gaping holes. At the same time, the semilunar valves are closed, but when the ventricles contract, take a look at the tricuspid and bicuspid valves are closed, blood cannot flow back to the atria, the point where we are looking here. And the pressurized blood from ventricles will open these semilunar valves. And so whether it's the pulmonary valve opening the pathway of blood to the pulmonary trunk, or the aortic valve opening to open the pathway to blood to the aorta, this is the picture you would see inside the heart when the ventricles are contracting. And you can see how tight the closure of the bicuspid and tricuspid valves, preventing backflow. Take a look at how tight the closure of the aortic and pulmonary semilunar valves, preventing the backflow of blood from these blood vessels into the ventricles. So this is how valves serve their purpose of preventing backflow of blood into the previous chamber. We'll be saying a lot about and focusing a lot about cardiac muscle in the heart. Valves have a tremendous importance in directing blood flow, making sure there's no backflow of blood. The construction of these valves is such that they are connected through an underlying network of connective tissue layer. This connective tissue layer totally separates the atria, which are cut away in this view, from ventricles that are below these valves. And that electrical insulation will be tremendously important in timing the contraction of atria versus ventricles. We'll come back to that in the second lecture. So valves are not made of muscles. Valves are made of connective tissue. They form a separate network of tissue outside of cardiac muscles, and they are serving as an insulating purpose as well. And here's the artistic rendition of opening and closing of the bicuspid valve. So right here on the left side, you see a bicuspid valve during the filling of the left ventricle. The left atrium is somewhere right up here. The left ventricle starts at the rim of this valve. So the valve is open while the ventricle is filling. But when the ventricle is contracting, the pressure closes the bicuspid valve. Take a look at the chordae tendineae, how they stabilize the bicuspid valve, and blood cannot pass through here. There's no backflow of blood into the left atrium. So the valve successfully fulfilled its function, preventing backflow into the left atrium in this case. And I think this is just the second part of that. For the semilunar valves, they open when the ventricles contract, whether it's the left ventricle contracting, opening the aortic valve, or the right ventricle contracting, opening the pulmonary valve. And when the ventricles relax, the semilunar valves close. So this action of the left and right ventricles maintain two separate pathways of blood flow. You've heard the blood vessel names. From the right ventricle, the pulmonary trunk, pulmonary arteries take blood to the lungs. From the left ventricle, the blood is pumped into all organs. So the destination of the blood is very different when we look at left versus right ventricles. So I'm going to step ahead here to this illustration. So let's take a look at first the right side. Here's the right ventricle, and you can see the blood flow. It's blue because it's only deoxygenated blood that's coming through here. So from a right ventricle through that pulmonary semilunar valve, pulmonary trunk will take blood all the way to the lungs. Blood gets oxygenated. This is why the color changes from blue to red. And now this oxygen-rich, oxygenated blood is moving through the pulmonary veins back to the left atrium, arrived back into the heart. When you take a look at this arching shape on this illustration, this blood flow from between the right ventricle and the left atrium is called the pulmonary circulation. It's called pulmonary circulation because the lung is at the center of it. Blood is pumped into the lung, and oxygenated blood is coming to the heart from the lungs. So the right ventricle is in charge of and driving blood flow through the pulmonary circulation. Once the blood moves from the left atrium to the left ventricle, from left ventricle, blood is pumped into aorta and a large number of other arteries in the body and many organs. This little set of capillaries, this could be our brain, this could be red bone marrow in dozens of places, this could be our skin, this could be individual bones, this is representing 700 plus skeletal muscles, all the visceral organs like liver, small intestine, large intestine, stomach, tongue, all the organs of special senses. So the left ventricle is maintaining what's called the systemic circulation. Sometimes it's called peripheral circulation. So the destination of blood from the left ventricle is totally different. This systemic circulation comes to an end when blood returns to the heart, to the right atrium, through the superior vena cava, inferior vena cava, and the coronary sinus. So the right ventricle drove the pulmonary circulation. The left ventricle is driving the systemic or peripheral circulation. And this is where this is really neat to know that our heart has two pumps. And this is the only way we can drive two separate circulations. The right side is driving the pulmonary circulation. The left side, starting from the left ventricle, is driving the systemic circulation of blood. We'll come back to this view. When we take a look at these two circulations, we do that with the assumption that the left ventricle and the right ventricle is pumping identical blood volumes. What comes out from the left ventricle will eventually move, what comes out from the right ventricle will eventually move into the left ventricle. So these two pumping chambers are pumping at the same pace, same volume. That's the basis of this totally uninterrupted pulmonary and systemic circulations. So there is a third, much shorter circulation. When we say the word circulation, we're talking about a pathway of blood that starts from the heart and comes back to the heart. So the coronary circulation is nothing else but a mini circulation that targets the heart muscle itself. So take a look at the heart itself. The heart muscle works incredibly hard 24/7. It needs a good deal of oxygen and nutrients. So makes sense that we send ample blood supply to the heart muscle. The blood supply is coming to the heart through these coronary arteries. You see the two coronary arteries. Here's the one, and here's the second one. They both originate from the aorta. So from the left ventricle, blood is pumped into the aorta. From the aorta, coronary arteries move blood to the cardiac muscle. The second part of this coronary circulation is coming from the coronary veins. So deoxygenated blood is collected from the heart, and that deoxygenated blood is merging through a set of coronary veins all the way to this structure, this wider structure on the opposite side of the heart. This is why it looks so faint on this artistic rendition. This is the coronary sinus. The kicker of anatomical curiosity of the coronary sinus that it opens up into the right atrium. And that is the end to the coronary circulation. So we started out from a left ventricle, went to the aorta, coronary arteries bring blood to the cardiac muscle. We collected the deoxygenated blood through coronary veins, and through the coronary sinus, this blood is moved back to the right atrium. So we started from the heart and came back to the heart. So this is the coronary circulation, this mini circulation serving the heart muscle. The equal effectiveness of left and right ventricle is essential for the workings of the body. It kind of makes sense that as much blood is pumped into the lungs from the right ventricle, the same blood, same volume of blood is pumped to the body from left ventricle. This is true when both sides of the heart, where both pumps are pumping with equal efficiency. Congestive heart failure is a disorder where one side of the heart, one side of the pump is not working properly. The other side does. So here is a mismatch in the cardiac output, mismatch in the blood volume pumped between the left and right side. Now, why would something like that come about? Take a look at congestive heart failure, and you'll see by the end of this explanation that congestive heart failure is a collective name for a large number of disorders that can create this condition. So coronary artery disease can decrease the effectiveness of either left or right ventricle. It depends on where this disease develops. And when coronary artery disease slow oxygen and nutrient delivery to one particular ventricle, that ventricle will pump with lower force, therefore lower volume, and creates a mismatch between the output of the left and right ventricles. Myocardial infarct. This is a disorder where heart muscle cells die or are very uncomfortable, mostly because of the restricted nutrition and oxygen delivery. Myocardial infarct means that a little scar tissue is forming inside the heart. Scar tissue doesn't pump, and therefore whether the myocardial infarct formed on the right or the left side, that side will be impaired in its pumping activity. Valve disorders. How could valve disorders change the working of one or the other side of the pump? Valve disorder means in plain English that backflow of blood is now happening. So the left ventricle, for example, if the bicuspid valve develops a disorder, it means that the left ventricle, when it contracts, it will pump a portion of the blood back into the left atrium because the valve is no longer working to shut the door. So in that case, the left ventricle will be pumping lower volume into the aorta, again causing a mismatch of production output between left and right side. And there are congenital defects that damage either left or right side of the heart, again, leading to an unequal work production, unequal blood pumping on the left and right. So let's take a look at what is the consequence of left side heart failure and the right side heart failure. Congestive heart failure means that blood congestion will occur. Now, I'm going to use a traffic analogy. Wherever there is a construction or an accident on a highway, traffic will build up behind that failure, if you will, and congestion of traffic will occur. Very similar situation happens with congestive heart failure. I'm going to go back a few slides because this is the best image to explain this. So let's take a look at left side heart failure. It means that the bicuspid valve might be damaged, left ventricle may suffer a myocardial infarct, or it's just not getting enough oxygen nutrients because a coronary artery disease. Could be the aortic valve is damaged and blood is flowing back into the left ventricle instead of moving through the aorta. At any rate, imagine the flow of blood through the left and right ventricles as a highway with 5 lanes of traffic. Normally, the left and right allows car traffic to go through all 5 lanes. When we have left side failure, the left side of the heart is now allowing only 4 lanes of car traffic to go through. And because the cars are going through the right side, 5 lanes at a time, there will be some traffic buildup behind the failure. So on the left side failure, blood is going to be building up because of the excessive traffic from the right side. All those cars will be building up right here. And this is causing blood congestion. Blood congestion means that blood is pooling in these blood vessels. They cannot go through the left ventricle because of its restricted work, the left side failure. So what's the effect of blood pooling, congesting right here? The most stretchable and vulnerable part of this vasculature here are the capillaries, the tiny microscopic blood vessels of the lungs. They will be stretched and plasma will be squeezed through the wall of these tiny blood vessels. So fluid from the blood, fluid will be accumulating inside the lungs. That condition is called pulmonary edema. That leads to coughing and wheezing and decreased respiratory effectiveness. Gas exchange will be limited and more or less serious respiratory stress will develop. So left side failure will lead to the buildup of blood, congestion of blood behind this failure. And by causing pulmonary edema, this left side failure will lead to respiratory distress. Let's take a look at what happens when the right side fails. So traffic is going to be going through normally through the left side, but now we have only 4 lanes of traffic going to the right side because of myocardial infarct, a valve disorder, or for some other reason, the right side is no longer pumping blood into the pulmonary trunk the same speed as the left ventricle is pumping blood into the aorta. Just like in case of traffic congestion, the choke point, the right ventricle, will lead to a traffic buildup, blood congestion behind this failure. It means that blood vessels those tiny capillaries in all of our organs will be stretched. The most visible effect of this would be the edema that develops in the lower extremities. This peripheral edema, systemic edema, will lead to fluid flow from the blood vessels, and that plasma that escapes from the blood vessels most likely to pool in the lower extremities. Gravity is pulling it down, and that will be the most visible effect of right side failure. So congestive heart failure, whichever side fails, will be leading to blood congestion behind that failed structure and causing edema, the leakage of plasma fluids from the capillaries. So here's the description of these left and right side failure of the heart. Again, combined expression for these failures, and the consequences is congestive heart failure. So one of those conditions that cause congestive heart failure is coronary artery disease. Take a look at a normal versus an obstructed coronary artery. So these are the arteries now that are moving oxygen and nutrients to the cardiac muscle. It's kind of plain to see that through this obstructed artery, maybe half of the blood flow and therefore half of the oxygen and nutrients will be flowing to the cardiac muscle. The ischemia or oxygen deprivation will at first inconvenience the side of the heart where it's happening. And so that chamber, usually the ventricle, will be pumping much less efficiently. When the damage reaches a breaking point, a myocardial infarct will be the consequence of long-term oxygen and nutrient deprivation of the myocardium. Excuse me. So what to do about a coronary artery disease with the blockage? So here you see one of the coronary arteries in artistic rendition. Here's the blockage. One can create a bypass graft. Take a look at this new blood vessel. This usually comes from either from the leg or from the forearm of the patient, and it is sutured between the aorta and the point past the obstruction. So here we are bypassing the blood flow past this obstruction, and we can restore blood flow to the cardiac muscle through this bypass graft. If you heard somebody having a double or triple bypass surgery, it means that the surgeon needed 2 or 3 of these new blood vessels to bring blood past this obstruction. We can deal with this obstruction a little differently. There are tools that are built into a catheter, and here you can see the flattening of this obstruction. When you flatten the obstruction with a balloon catheter, the blood flow will be restored, at least to some degree. Another way to not only to flatten the obstruction, but keep the blood vessel diameter the same or steady, is to put a stent in there. A stent can be attached to the tip of a catheter, pushed into the right position and released. So stents are another way to keep coronary arteries the appropriate diameter, and therefore continue to supply oxygen and nutrients to those cardiac muscles. And the last slide here is just my contractual obligation to tell you about exercise and the heart. Exercise not only has a beneficial effect on the cardiovascular system and the heart, but all organs, including brain, organs of the respiratory system, skeletal muscles benefit from this. So I know it takes time, but this is a preventative health measure. And when the heart is trained to use efficiently oxygen nutrients when it's stressed during exercise, the heart will be a lot more able to withstand minor stresses coming from a beginning coronary artery disease. So this is a great way to postpone malfunctioning of the heart by regular aerobic exercising. So I'm going to stop sharing here. So this was the first chapter. I'm sorry, this is the first part of chapter 20. I hope to see you guys on Tuesday, and we'll continue with chapter 2, looking at more of the physiology of how the heart works.